Hey, we're at really the last, I guess, didactic portion of our program. And at this time, I'm going to give you an appeal for research participation. We've prepared a brochure for you that kind of details the different research studies that we have available here at the Emory Alzheimer's Disease Research Center. And look there, and if there's something you like, we'd certainly love your participation. We have studies that are very low risk called the Emory Healthy Aging Study, and we have some coordinators here. Come start, make your way this way, who are going to talk to us about those different things. But I think it's important for everybody in here from a healthcare perspective to get involved in some clinical research study somewhere. If you're not interested in Alzheimer's, but you're interested in, let's say, heart disease, or you're interested in good joints, there's something called researchmatch.com. You can put in your specific interests and they can find a study that is consistent with what you said you were interested in. So I'm going to be a strong advocate for research participation because I think it's a good way and a cheap way, if you want to say it, to get better health care. Because if you're working with a coordinator, they're going to inform you about things that are abnormal and give you information to take back to your provider to discuss or have further evaluated. Research is not a substitution for good medical care, but it's certainly a way to make you more participatory in your own care and, more importantly, make you more informed about what kind of care you should be receiving. So if you don't want to do Alzheimer's research, fine, I'm happy with that if that's what you want. Find something else to participate in, because we have a tendency in our society to wait for somebody to do something for us or get done to. You want a pill for the dry vaginas. You want a pill for improving your libido. And, some of that stuff just isn't possible with a pill. So the more informed you are, the better you are to take care of your health. At this time, we have three people who are going to talk to you about studies we have here. Natalie Zimmerman from the George Goizueta Alzheimer's Disease Research Center, Jessica Udry from our Healthy Aging Study, and I had integrated memory care, but all three of you, come on up here. I'm going to let Laura go first because she is the social worker and director of a care program, primary care program that's integrated with neurologic and psychiatric care here at the Emory Alzheimer's Disease Research Center. It is a model of care for everywhere, and it started as a research project that was funded by a private philanthropist who said, we need to have our primary care at the same place where we get our specialty care. So if you have a family member who has dementia or some other neurologic psychiatric disorder, you may want to get them care at our integrated memory care clinic. So this is Laura Metters, and she will be followed by people from the Emory Healthy Aging Study, our General Alzheimer's Disease Research Study, and which one are you doing? You're both doing Healthy Aging?
All right, thank you, everybody. My name's Laura Metters, and I'm the social worker and administrative manager of Emory's Integrated Memory Care Clinic. As Dr. Parker said, it's a primary care clinic for people who've been diagnosed with a type of dementia, and we try our best to combine primary care and neurology care in one spot, as well as many other chronic conditions, to cut down on the number of specialists that our patients are seeing and the number of appointments that you're having to bring your loved ones out to. So as much as we can, we try to coordinate care in one spot. We're a one-stop shop. We've been compared to Walmart, which is not our favorite comparison, but we do our best to try to make things easy for our patients and families. We are at Executive Park, which is more convenient for some people than going all the way to the Emory-Clifton corridor for clinics. We have free parking and complimentary valet, which is what our patient family advisors tell us is the most important thing that people should know about the clinic. We have an after-hours number for our patients and family members to call for a nurse practitioner as part of the team to triage concerns that you have to hopefully keep people out of the hospital if we can. As the social worker for the clinic, I provide a lot of caregiver education, workshops, support groups to our patients and family members so that it's not just the person who's living with dementia. We know that this disease affects the whole family. we try to provide a lot of support to everyone who is going through this journey together. So if you have a diagnosis of a type of dementia and live within an hour of the clinic, we would be happy to see if this might be a fit to serve y'all's needs. Thank y'all so much.
Hi, my name's Jessica. I'm with the Emory Healthy Aging Study, so I'm sure I talked to a lot of you guys out there. So I'm just going to give you guys an overview of what our study is. So our study is kind of a big, ambitious project. Our goal is to have 100,000 participants be a part of our study. So that's a ton of people. So we would love to have all of you participate. It's open to everyone 18 plus. So what we're trying to do is gather a bunch of information about people as they age, so we can learn more about aging, the normal aging process, and also abnormal aging. So diseases that appear as people age, such as heart disease, Alzheimer's disease, and what other information we can find out. So all we ask from our participants is to complete a short 20-minute survey. It's totally online. And the 20 minutes is from actual participant data. It should really not take you that long. It just asks information about your health history, your dietary habits, how much you exercise, and things like that. And you can find that on our website, which is healthyaging.emory.edu. Again, it's anyone 18 plus, so let your friends, let your family know. It's a super easy thing. We also have a couple sub-studies, so if you complete the Healthy Aging study and you're eligible for some of these other studies, we might contact you. Our biggest one's the Healthy Brain study, and we're really interested in people who are 55, or 50 to 75, excuse me, and that would involve an in-person visit where we do a collection of biospecimens, we do a blood draw, lumbar puncture, and cognitive testing, and we have some other studies we might contact you for as well. All right. Thanks, guys.
How's everyone doing this afternoon? Everyone still doing okay? Okay, so I'm Natalie Zimmerman. I work with the Goizetta Alzheimer's Disease Research Center. Now, some of you might have smiled at me earlier. I might have handed you a brochure. So what we're doing here at the GADRC is we have at least 20-something different studies currently going on. I see some familiar faces because I know some people are already in studies with us. But if you guys are interested in research with us, these yellow sheets of paper that you got, all of this information is going back to us. So this is Naima. She is also a part of our group. We're going to be calling all of you, okay? So now it might take a couple of weeks because there are about 4 or 5 of us calling about 400 of you. So I ask for you guys to be patient with us. If you do have any other questions or concerns, in the brochure here, I think it's on page 8, it says contact us. And it's also got our information and website down here. And if you go to the website, there are also some other studies that weren't listed here today if you guys are interested in them, okay? Thank you.
Does anybody have any questions for Laura Metters about the Integrated Memory Clinic or any of our coordinators regarding research? No questions? Healthy aging.
Sorry, I know it's super confusing. So we have the aging study, that's the online survey, so that's anyone 18 plus, so anyone can do that. That does not stop at 75. The sub-study that we have, the Healthy Brain study, since it's a study we would want people to do every 2 years, I guess I didn't mention that either, we would like their first visit to be before they're 75, if that makes sense. So anyone can do the survey. You might be contacted for the other study if you're between 50 to 75.
And we also have a study we call Memory, which is a longitudinal study. We don't really care how old you are. The one thing that we do like, if you get involved in our longitudinal study, which is where we're just doing a memory test every year for you, is we're trying to see how people age normally and try to pick up when things are abnormal. But a good thing that people can consider, because this is also research, is when you no longer need your brain, we would like to have it. And that is so that we can study things a little bit better. And if you're part of our longitudinal study, we've been following you for a while, and it's a way to check to see whether what we interpreted or saw in life is the same in terms of pathology when they're analyzed at time of death. So if you are interested, we would like to have your brain when you no longer need it. But we don't want to just take it from you, just, "Oh, I'll give it to you today." We would like to study you while you still have it and you're still upright and mobile, okay? And we have longitudinal studies for that. There is a question that has just been asked: why don't you share research results? And I think Dr. Law answered it a little bit earlier. One of the things in research is we are obligated to make you aware of things that are abnormal and may be a risk to your overall health. And we're going to tell you about that, and we're going to make sure that you get assistance, getting the kind of assistance that you need or evaluations that you need through us or through your primary care provider. But a lot of the things that we're looking at and that we're testing in research aren't necessarily things that we have an answer for or have a validation for. So ApoE3, ApoE4, it's a gene that's associated with Alzheimer's. That's not the only gene that's associated with Alzheimer's. There are about 35 or 40 different genes that are associated with Alzheimer's. In research, we may be studying those genes, but none of those particular genes has a whole lot of evidence to make any sense of, if you understand what I mean. You got it, but what does that mean? We don't really know. And so when Dr. Law was talking earlier, he said sometimes giving people information that doesn't tell you anything is adding more anxiety to people. So if it's something that you have to know, that you need to know to make your life better, we're going to help you with that. Right now, disclosure of research results, let's say you do the ADNI study and you do the special PET scan. I want to know what my PET scan says. Well, some centers, some studies will give you those results immediately, some studies will not. But in general, if you participate in research, you're anonymous. None of the research results that we get in research show up on your medical record. They're divorced from your medical record. This is a way that if we find something that's unusual, there's no way to deny you insurance coverage. Those are the things that are important when you think about research. There's privacy involved, and again, research is not a substitution for medical care. It's a way to learn more about what kind of care you should get and how you should ask for things. That being said, you're not necessarily going to get the answers for your research. So we have these coordinators here and out there. If you've been to their booths, you got information from them, and we look forward to seeing you in some of our studies. At this time, I'd like to say thank you to all of our hostesses from the Atlanta chapter of the Lynx, the Atlanta alumni chapter of the Delta Sigma Theta, Alpha Kappa Alpha Sorority Chi Tau Omega and Lambda Epsilon Omega chapters. Those are our hostesses. They've been our hostesses for the last 17, 18 programs. So thank you all very much. Thank you to all of our sponsors and supporters. You see them up there on the board. Coca-Cola, I have to make special mention of them because they have been with us from the very, very beginning when we started doing all of these forums here. Not just here, we started at the Carter Center. If you've been with us, you know that's where we started. So our outreach to the community started in 2010, and we started at the Carter Center, and we've grown to this particular space. If we get too much bigger, we won't be able to accommodate us all. So thank you to Georgia Power, the Alzheimer's Foundation of America, which funds the nurses who do our community screening events, the Healthy Aging Study, and the Alzheimer's Association, who partners with us to improve professional education around the state. Okay, next Thursday we have a research social. Crystal, huh?
So yes, next Thursday, May the 9th, is our research social. Can everyone raise their hand if this is your first time attending a brain health forum? Okay, of these hands, who all completed a yellow research interest form? Keep your hands up real high. There are going to be some volunteers that are going to give you the information about how to register. This is a flyer. Please keep your hands up. They're in the back. These ladies right here are going to pass them out. Keep them until you have one, keep them up. But the information to register for that is at the bottom. My phone number, as well as the registration direct website, is on there. It's more of an in-depth one-on-one discussion about research where you get to meet Dr. Parker, some of our other neurologists and physicians there to learn more about our available current research studies if you're wanting to be involved. We have a nice warm lunch, and then we get straight in, and then we'll probably have a research testimonial of a current research participant to tell about their experience as well. So if you have any questions, my name is Crystal Davis. I serve as the Minority Engagement Coordinator under Dr. Parker, and I'm happy to answer any questions you may have. But keep your hands up until you get one of these forms. I'm going to pass them out as well. Thank you.
Okay, are we ready for our drawing? Last call for our passports and evaluations. Passports and evaluations. Make sure your name is on your evaluation and on your passport, because if I pull a gift card, you have to have a name that goes with it in order for you to receive it. We have how many? 26 gift cards to give away. I'm going to need one hostess to be a recorder